Hey friends, it's time for another behind the scenes look at how God is at work here at Watermark. This week, I'm going to take you inside one of our most strategic ministries in this city, Watermark Health. With two Watermark urgent care locations, there's one in Collin County and another in Northeast Dallas, Watermark Health is in the business of mobilizing the local church to meet the needs of the under-resourced and uninsured in our city. All the while, we're engaging hearts with the power and truth of the gospel. Let's catch up with the Executive Director of Watermark Health, Christy Shermack. Christy, will you just tell us a little bit about what you guys do?
So David, a lot of people might have heard things like Watermark has a clinic, we do some medical ministry, and that's absolutely true. For the last 7 years, we've been serving our city through things like school physicals, pregnancy tests, flu tests, different small, minor trauma, injury type events where we get to meet their medical needs, but then also take care of their spiritual and emotional needs that are going on. The Lord has done some awesome things the last 7 years. Just last year, our two clinics saw 11,000 patients, saving the citizens of Dallas $12.1 million, all while seeing people from all over the world, 139 countries actually.
How has a global pandemic impacted what you guys do?
Well, one of the first things we did was we launched a COVID-19 testing site right here on Watermark's campus. Through that site, we've been able to serve 1,500 different people, 500 of which have been uninsured, so we're providing a free service to the city for those uninsured patients. We've also been able to use that site to spot outbreaks happening at a couple different factories and residences here in DFW.
Okay, so one of the things I know I'm most excited about is this mobile clinic. Can you give us an update on the progress there?
Yes, so last year around this time, we got to share with the church body that we were hoping to launch a mobile clinic that could go into the most vulnerable parts of our city and serve people. The church showed up in a big way, and we had the construction fully funded within the first couple weeks of sharing that desire. And so now, construction's almost done. We're ready to use that mobile clinic any day now, and we'll be able to put our medical professionals in it and serve urgent care needs all throughout DFW.
Okay, so that's the mobile clinic, but I've also heard the term pop-up clinic. What's the difference and how does that all work?
So we didn't want to wait for the building to be done to start serving people, especially in the middle of a pandemic where everyone's worried, there's a lot of urgent issues arising. And so what we did was we went ahead and we are now loading in and out tents, tables, medical supplies. We're taking nurses, providers, pastoral care staff to our ministry partners, setting up on site with them and seeing patients right then and there. So we're calling that our pop-up clinic because quite literally it pops up and then it disappears at the end of the day.
Ultimately, the mobile clinic will replace the need for a pop-up clinic.
That's correct. So as soon as we get the construction done, which should be any week now, we'll be able to use that instead, making our services much more effective and helpful for DFW.
All right, look, contrary to popular belief, I'm not a doctor. So, how can I help serve Watermark Health and the impact you guys are having on the city?
If 2020 has taught us anything, it's that we cannot predict the future, but God is always in control. So what we're doing is we're raising funds to be able to continue pivoting, just like we have been for the beginning of this year, continue pivoting towards the new needs of our city, whatever those might be. We have a list of ideas. We think we kind of know what some of them are, but we're going to stay flexible and innovative so that we can serve the best way.
Gosh, Christy, thank you so much for taking us behind the scenes of Watermark Health. And Watermark, listen, now you know a whole lot more about what we're doing to serve our city, and we can't wait to see how you participate and join in. Let's go, church.